It's another day with the physicians where your health is our business.
The growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what is low?
You're welcome back to the training of your regular program.
Care, the virus has no feelings, no political ideologies, no loyalties, nothing. The virus is going.
Almost 1 billion poor people worldwide have little or no access to reliable, affordable energy to cook, filter their water, or even communicate with public services. Households now rely on collected fuel wood, otherwise known as charcoal, to prepare food and fossil fuel to run generator for pumping water. Clean energy has become a necessity to pump water, to grow food, and to maintain personal hygiene such as washing hands to limit the spread of COVID-19. We will be discussing improving health through enhanced access to clean energy and food with our expert on your favorite health TV talk show, The Physicians. It's another interesting day on your favorite health TV talk show, The Physicians, where your health is our business. Today we will be discussing improving health through enhanced access to clean energy and food. And of course, I remain Dr. Memuna Yusuf Kadri with my usual and favorite co-hosts,
Dr. Martina Agbere.
You look green, and we're talking about clean health.
Of course.
Access to clean energy.
Green, that is the word.
And you know, this is so timely and so important because with all the COVID and the lockdown and the different variants and all that, we're having challenge with food. Cooking,
food security.
Food security is becoming
a challenge. There's a threat.
What's the cost of cooking gas in your area? 12.5 kg.
About 10,000 naira.
I know this is so frustrating because now we are going back. We say charcoal is not good. Charcoal will give you smoke. It has health complications. We are going back to that.
Nobody even advise anybody to go back to charcoal. When you go to refill your gas, you just say, well, what's the alternative? What am I going to use now? After gas, what else? Kerosene, charcoal, firewood.
Kerosene is expensive. So
if you decide I want to use firewood, it's again you are going to start deforestation. Which shouldn't be.
Which we say we've been encouraging afforestation.
What are we supposed to do?
1 step forward, 10 steps backwards. It's such a big issue.
And now food security?
Climate change challenges. So now how do we improve this access to clean energy? And I'm happy we have an expert who is going to, now doctor, all those PhD people.
I think even though the rural communities will be happy, they will be laughing.
Like, shouldn't people went to gas? We'll come back to charcoal, and now the price of charcoal has gone up.
That is the problem. You know what?
Nigerians,
whenever there's an opportunity, they just...
And it never comes down.
Come down. I don't see that gas coming down again.
The way you're talking about is as if you are vexing.
I'm very upset. It's
to
very
try it because not say because
that should be advice.
Because the way it's looking at people will say, no, I'll cook in the morning for the whole day. And it comes with all the other complications of warming and, you know, it's such a whole mess. How healthy are we?
Very frustrating.
How healthy?
To cook, then you put the food probably in the freezer.
Exactly. That's lightweight. Or you put it in coolers or in pots, you have to rewarm again. I don't get it. That one step forward,
Okay.
We've got an expert in the house. We'll be right back after this timer. Do stay with me. Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. And today is such an interesting topic we'll be looking into, because why? We all eat, and because we all want to survive, you must eat. But again, how do we get access to clean energy and food? So our guests will be talking about improving health through enhanced access to clean energy and food. And you know, the guest in the house is such a brilliant and cerebral, we call her Professor. She is no other person than Miss Peace Nnabugwu, an applied physicist, climatologist, and a certified STEM counselor for children. Just meet my honorable guest, the amazing and beautiful, we call her Professor Peace. You're welcome.
Dr. Memuna, I think I got that professorial chair from the school of Dr. and Dr. Mrs. Memuna Martina.
You're welcome. Yeah, so today's topic is very key, because as we are in the studio, we want to survive, we want to eat, we want to be able to have clean energy. What everything is all about how healthy is it. So it's good for us to have a good overview of what's clean energy.
Okay. Thank you once again for having me. From the literal meaning of clean, it means to be tidy, to be neat. There's something we call dirty cooking.
Oh, wow.
Dirty cooking is when you use fuel such as your charcoal, your fuel wood, or the kerosene stove, because it emits this noxious fume. What you call the carbon monoxide, small particles, things that causes health issues. This method of cooking, should I call it, is now outdated.
Don't say that, because our party jollof. Is that not what to do, charcoal?
Well, how about the roasted plantain?
Let's not confuse our prof. I'm sure she's heading somewhere with this discussion.
You know, this method of cooking actually exposes humans to various types of diseases like pneumonia, cardiovascular diseases, right? So you don't want to, in the name of cooking cheap, expose yourself to health issues that will cost you more. Right?
Aim of eating cheap, expose yourself to health challenges that will cost
you more.
Wisdom.
And not only does it expose you, the actual executioner, it also impacts on your environment,
air
particularly
pollution.
and then generally, right? And currently now we're at 1.1 degrees global warming.
What does that mean?
What it means is that the threshold to which we have risen, our global warming rate has risen, is at 1.1 degrees.
What's the number?
It's supposed to be lower than that. And at 2%, you will feel the kind of heat that you will feel. Right now,
it's so hot.
So once it gets to 2%, 2 degrees, it will be terrible. For you not to get to that rate, we have to make conscious efforts to behavioral changes towards how we use our energy. And so it's important that we transit from the dirty
to the clean.
Yeah.
So tell us about the clean.
Okay, so the clean would be what I call your use of energy in a cleaner way, where you don't have to emit, hazardous fumes, carbon monoxide to the environment, using your electricity.
Okay.
Using biogas.
Okay.
I know there are some stoves right now that can also burn solid fuels in a cleaner way. The Global Alliance for Clean Cooking, they are doing a great job, in that aspect.
Affordable are those ones?
Affordability is a relative term.
Okay, when you look at the cost of
when you look at the overall cost of your health, right? Again, but they are affordable. They are cheaper than the natural gas the liquefied gas that we're using at the moment. Yeah, they are far cheaper.
Okay.
Okay, in those days, our forefathers never had access.
Okay, so the thing
you talk about the disease conditions and all those ones. Because if you ask, they will ask, what happened to our grandparents? They lived over 100 years.
There are two. I have two ways to answer that question.
Please go ahead.
One, when they come down with diseases, you didn't also have enhanced health care to diagnose what actually is the cause of.
But some of them live up to 90.
Well, they had access to clean water.
Okay.
We are a human is made up of more water than other elements in your body. So when you have access to clean water, it helps to detoxify you and bring your body back to its balance. So they had access to clean water, which we are lacking.
And maybe cleaner food, and more natural food, vegetables.
Well, so there was still emission.
Emission then, okay.
You can't rule that out.
Okay.
There was serious emission. There was serious health issues.
Okay.
Why they lived to, as you claim, 90 was because, again, there's vegetation.
Okay.
I rather go with the vegetation. Because in those days, how many people had access to clean water?
Yeah.
No, they have the stream.
The stream.
They go to the stream, and the stream is cleaner because you have silicon that cleans they bathe in that water.
Yes.
They still drink that water. You think it was the one they bathed in? No, because the silicon, the roots of the trees around the stream, has natural cleaning properties that God has put in it. So it cleans that water, resonates minerals back to that water, and brings it back to its premium state. So when you take such water, it will restore your body back to its normal balance.
Do we have any of that in Lagos?
Yeah, we have.
To that.
If you don't have access to
can you generate it on your own?
We have, as the Food and Climate Organization, we have a filter, 9-level filtration filter that can give you your borehole water. It will filter it and bring it back to a premium state.
Those are the things we should be discussing about because truly, how does this whole how does it affect our health? Right.
So I read a report from the United Nations that we have over 4 million deaths annually, premature deaths, and over 50% are women and children. Anything that can lead to death is very risky for your health. So exposure to carbon monoxide, these noxious fumes, is not a healthy option for anyone. You might live in a highbrow area, but don't forget you drive through these other areas that are predisposed to these conditions, so you become a secondary participant. So it is a collective concern
for
everyone, and it has to become even a political priority. We need policies that can back adoption of clean energy. We need more awareness. We need more advocacy for individuals, for the users, to become aware, self-aware of the implications of these things to themselves first.
Okay. So we're talking about improving health.
Yes.
Through enhanced access to clean energy and food.
Yes.
I want to zero in on the food aspect.
On the food.
Yes. Now we have a lot of the way the food is produced these days. For instance, the gardens. we don't even use the natural process anymore, manure and such. What do you have to tell us about that?
Okay.
What is the ideal? What is going on? What is the ideal? Because now you have artificial vegetables everywhere. Is it because of the growing population that people are unable to now use the natural farming method in producing food? I will now have to add artificial things to ensure that we have meets the needs of everyone?
Okay, so population plays a great role in that concern.
Yeah.
However, we have to, like I said, make conscious efforts for ourselves. So people need to find clusters of individuals who are health conscious to begin to do cluster farming. Right? There are very easy ways that you can farm things at the back of your garden. You don't need a farmland. Yeah. No, you don't need a farmland. We even have what we call the soilless farming. Right? So people need to be, so at the Food and Climate, again, we are creating such clusters where people are being taught how to utilize their garden, how to, belong to clusters where you can have access to food supply.
Let's hold it there. It's getting more interesting because truly that cluster farming, and there are so many like estates, around that you can say this is what we can do within this estate. Let us be growing cucumber, growing this. Let's hear from you. On the street, we're keeping up with the physicians. This is an interesting topic. Access to clean energy and food, we need it. Climate change issues are becoming a big, big problem. We'll be right back after this timeout. Do stay tuned.
A clean environment is when there is that is free from anything that is unclean. That environment is clean. The options are from our primitive age or our forefathers. When there is increment in the gas, they go to the low commodity, which is either the use of charcoal or firewood, which is being used by our forefathers or our elderly ones before us. To me, there is no negative effect, although because from experience, our forefathers they have been using charcoal and firewood. It doesn't have any negative effect on them. So, because of the high increment of gases, and that is the lowest means in which they can afford, so they go into either firewood, use of firewood or charcoal, which is the lowest commodity.
If you're just joining us, this is your favorite Health TV talk show, The Physicians, where your health is our business. And we've been having an exciting time with our guest in the studio, who is schooling us on improving health through enhanced access to clean energy and food. We all want to live up to in our 90s and 100s, but how healthy are you? What are you using to cook? What access to clean energy do you have? And of course, we're talking about cluster farming. Before we went on break, that struck a chord in me. How do we get that kickstarting? What information do we need to see that we can come together, even not as an estate, like a group of friends, and we have a land, and there's so many lands around that we are not even doing anything with. So how do we do that?
In fact, the World Bank created a $500 million clean cooking fund.
We are talking about money now. My ears are now very.
Yeah, so it's open. You can you can apply to access it. Wow. And these are information that people need to get. It has to be a conscious effort. Take for example, if you live in an estate, you usually hold meetings. Yeah. So at your meetings, you can raise it up and say, can we start up a cluster farming? Again, it can become a form of investment.
Yeah.
And ultimately, you will also be impacting on your immediate community, because if you have surplus, you can sell quality food to older people.
So explain that cluster farming.
So cluster farming is when you come together as a group of individuals and accept that you want to do this, okay? And then we have access to lands that you can take advantage of.
Yeah.
They're very affordable. We have systems that can help you do the farming. You don't need to go to the farm. You can come and inspect your farm, but you don't need to come and till.
Wow, so you get people to help you do it.
Yeah. You can get people to do. We can, put together people that can help you do that, and then you have access. This food supplied either to your estate shopping mall where you all can,
have access
to it. And then if it depends on your agreement. So these are sort of programs that we help to put together in your estate. If your agreement is once this is harvested, give to every home in this estate, that's a different thing. If you want it sold in your shopping mall, that's a different thing. So it depends on what you come together to accept. However, it is very important for us to, consciously make it a priority, because of course, if you want to live long, you have to be very conscious of your health. Yeah.
So why is adoption of the clean energy law slow? With all this information that we now have in our hands, and World Bank is even having a fund out there for clean energy, why is the law still slow? Adoption of it.
That is if people are even aware that there is a law.
Yeah, so that's, I'll say, on two sides. We have the supply and the demand side. Okay, so on the demand side, the households, the individuals, they have little access to information and awareness. So that has to be increased. So we're so grateful that you're having us here today. And then on the supply side is the infrastructure issues. Because of course you're aware of it now. You can decide to ask for a clean stove and we supply to you. What if your neighbor needs it and we're not able to supply?
What does the clean stove entail?
Your normal system. However, the cylinder has another type of gas that burns cleaner
than the liquefied gas.
Okay, it has another kind of gas that burns cheaper.
That burns cleaner, and it is cheaper. How available is this?
And accessible, because availability, affordability, accessibility.
Okay, if I decide to buy from you,
you can get it. However, so right now it's the time for distribution. So we're calling on distributors. We're calling on interested individuals who can talk about it in their various locations.
Okay, because after buying and you're using and it's exhausted,
you will be taught how to replace it.
Oh wow! I think we need a session where we can do a demonstration. I think that way it will really be a very practical session to our viewers.
This will make the cooking gas price.
Yes, could it be a competitor to the cooking gas we are using right now?
I wouldn't want to use the word competition.
Complementary.
Okay. Because right now we are also advocating for micro partnerships, investments, conscious and calculated steps to solving our problems. And I don't want to forget this part.
Please.
We need more scientists who do research consciously. Yes, I want education to be more involving. Don't go to school and throw your certificate away. If you are a scientist, a biologist,
right?
We need you. Right? If you're a computer scientist, we need you. Chemists, we need you. Because now the World Bank has put out these funds. We need people
that are.
You don't just access this fund for assessment's sake.
Information. You must execute.
Do you understand?
You must execute.
We need to execute, implement. Right? We need this gas that we already have now. Research is never ending. Exactly. You can look into it and say, okay, this can be improved in this way.
Yeah, let's involve.
Yeah, so we need scientists. We need collaborators, economists, to come together. Let's put all hands on deck.
And
in what ways are you actually ensuring?
This information is out there. Because we need real right information dissemination.
Which is why we also accepted to come here. So we're working. Okay, so that's why we need partners. We need media partners like you. We need collaborators.
Truly, this information is so key because it's like this is new. It's not like it has been there, but hearing it from somebody in that field is so amazing. Thank you very much. Thank you. This has been so lifting and refreshing. And you can hear from our guests in the studio. Look, this, let us do it. The African proverb says, if you want to go fast, go alone. But if you want to go far, go with others. So cluster farming is a good thing. Now there's another way you can get food cleaner with a cheaper method, which is the gas she's talking about. Please, let us do right by us first. Because, as a human being, you want to live long, you want to live healthy. The cost, she made a statement with regards to, clean access to energy. The way you do it is better for you to do it right now. Be conscious and intentional about it, because if you don't do that, the cost to your health is much more. I remain Dr. Memuna Yusuf Kadri. Till next time, stay blessed.
I totally agree with you. The cost is actually more than your health. If you decide not to take care of your health, you spend more in getting health care.
Yeah.
You have to be intentional about the things that you do. Clean energy, clean food. You heard it today. Anything that is cooked using the charcoal is very injurious to health. If we have not taken anything out, but from today's episode, remember, the fish, the smoked fish that you take, before you put it in your mouth, is it good for my health? I leave you to think about that. My name is Dr. Martina Agbere. Remember to always follow us on our social media platforms. And if you want to be part of this program, just send us an email. Thank you for staying tuned. Same time next week, we hope to see you again. Take care and God bless you.
Okay, I'm Bisilola Ashenuga, founder ED Youth Rescue and Care Initiative. Women's mental health is key to economic growth. Let's not leave any woman behind. Support all the women around you and keep watching The Physician.
I'm a baby.
Yes.
So many women actually have that, and they will not know. The age group is quite legion. It's between 20 years, even earlier than that, to 50s. So women presenting with infertility, 70% of them who are not ovulating will have PCOS. Can you see how common that is?